fellow IHI Idea Challenge Committee members. Our team is Faith Boosters, Bureaucracy Busters. We are composed of 3 members, myself, Dr. Rebecca Elkins, Dr. Rhyanne McDade, and Nurse Manager Chandra Shannon. We hope the novel idea we present today will inspire hope and faith amongst healthcare workers in Kentucky by eliminating some of the bureaucratic red tape to promote a more person-centered and emotionally healthy work environment to specifically retain and attract a viable nursing workforce. The specific problems we aim to address were highlighted during the Great Resignation, also known as the Big Quit, which was spurred by the COVID-19 pandemic. During 2021, over 47 million Americans across all vocations voluntarily left the workforce. Keep in mind that pre-pandemic, the state of Kentucky was already experiencing a shortage of healthcare workers. So when 1 in 5 healthcare workers voluntarily walked away from their positions during the Big Quit, it left a especially heavy burden amongst healthcare workers. In fact, an executive order issued by Governor Andy Beshear on December 9, 2021, eliminated the pre-existing nursing shortage when noting that Kentucky was operating at 12% to 20% short of the needed nursing staff. Further, the state is projected to need more than 16,000 additional nurses by 2024. Several factors have been cited as to why this great exodus occurred. Leading factors include wage stagnation, long-lasting job dissatisfaction, safety concerns surrounding the COVID-19 pandemic, and increased work demand, which led to emotional fatigue, burnout, depersonalization, lack of empathy, and feelings of ineffectiveness. There's a desperate need to boost interest in the nursing field and retain those currently working. We feel that creating a more person-centered, emotionally healthy work environment will help retain and attract a viable nursing workforce. To do this, our solution is to propose legislation that specifically seeks to enhance overall mental and emotional well-being in the nursing workforce by addressing the following line items. First, mandatory nurse-to-patient staffing ratios. A minimum of 1 nurse to 5 patients would be required in all healthcare settings to improve nurse and patient experiences. Currently, the Kentucky Board of Nursing has not established a standard ratio for the given number of patients in which a nurse may be assigned. Suggestions have been provided for standards, but there are no requirements. This fact alone has disabled nurses from performing their jobs properly, leaving a lot of nurses feeling overworked, overwhelmed, and inadequate in regards to quality of care. The second, mandatory max hours of required overtime nurses are forced to work per week. Currently in the state of Kentucky, there's no limit on the amount of hours a nurse can be mandated to work in a given week. This became an especially crucial issue during the time of the pandemic, in which nurses were required to work an unprecedented amount of hours due to the healthcare shortages. So other states have supported their nurses in these ways, these policies and things. So why not Kentucky? We believe the proposed policy solution will work, because policy has the greatest potential to have the largest impact on the healthcare workforce. If enacted, this policy will require all county and city levels of healthcare facilities to comply with state guidelines. Further, the solution proposed reflects that of the public opinion and economic conditions which substantiate the aforementioned healthcare crises, nurse burnout, and fatigue. Putting policies in place that would address staffing issues as well as mandated overtime would drastically impact the nurse work culture and show the importance of nurse well-being. Lastly, the creation of a more person-centered and emotionally healthy work environment would help retain and attract that viable nursing workforce. So why is this solution superior to others? Public policy shows the healthcare community, specifically nurses, that they're truly supported from a top-down approach. Also, this proposal has the greatest impact to flood the nursing field with new recruits, as these policies would improve work conditions and increase applicant interest as a result of this new legislation. Further, the policy approach presented will help retain nurses currently in the field, and that policy changes, once enacted, will foster more supportive environments for current practitioners. Lastly, the creation of policy demonstrates the value that the government officials and key stakeholders place on nurses and their overall well-being through the provision of better staff-to-patient ratios and more stringent policies surrounding mandated overtime practices. Thank you for your time and attention.